Okay, in our video series of ECG interpretation made easy, in this video we are going to talk about sinus arrhythmia. We are also going to discuss sinoatrial block, sinoatrial pause, sinoatrial arrest, and we will solve many important ECGs. Now remember, SA node runs the electrical activity of the heart. SA node sends signals and causes contraction of the atria. SA node sends signals to the AV node and bundle branches and Purkinje fibers, and it causes contraction of the ventricles. SA node is the leader of electrical activity in the heart. Any rhythm that is run by SA node is called as a sinus rhythm. A sinus rhythm is a normal rhythm. Now, what sinus arrhythmia means that the rhythm run by sinus node is not regular now. Now, in some cases, it is physiological, like respiratory sinus arrhythmia. In respiratory sinus arrhythmia, what happens is that when we inspire, when we inhale the air, the heart rate increases. And when we exhale the air, the heart rate physiologically decreases. Now this change in SA node firing during inspiration, it increases, and during exhalation it decreases. That is a physiological phenomena, that is a normal phenomena, and that is called as respiratory sinus arrhythmia. Due to inhalation, sinus node increases firing and causes increased heart rate, and during exhalation it decreases firing and causes decreased heart rate. Now you would be thinking that why does sinus node starts firing more during inspiration and it fires less during exhalation? Basically, when you inhale the air, the chest cavity size increases. When the chest cavity size increases, the vessels also dilate and demand of blood to the chest cavity increases. So physiologically, heart starts contracting more to produce more cardiac output to supply blood to all these vessels, to supply blood to the vessels in lungs that have now dilated due to increased chest cavity size during inhalation. That's why heart rate increases during inspiration, and that's a normal physiological thing. That's a normal respiratory sinus arrhythmia. It is more prominently seen in athletes and in young children. But even if you do it right now, if you take a deep breath and you check your pulse, you will feel that there is slight increase during inspiration. And then there is something called as non-respiratory sinus arrhythmia. Remember, non-respiratory sinus arrhythmia is not normal because it is not related to the respiratory, inhalation, exhalation. The sinus node sometimes starts firing more and sometimes the sinus node gets slow. Now that is not related to the respiratory, inhalation or exhalation. That is not a normal thing. It is seen in ischemic heart disease. It is seen in structural abnormalities and sometimes in elderly people. Now this non-respiratory sinus arrhythmia, the activity of sinus node is not related to respiratory system. The sinus node starts firing more sometime, the sinus node slows down sometime, and it is not associated with respiratory, inhalation or exhalation. That is an abnormal thing. Now we will solve some ECGs. If you look at this ECG, you will be able to appreciate that the RR interval over here is shorter as compared to RR interval over here. RR interval over here is longer as compared to RR interval over here. Now, if you have a longer strip, you will be able to appreciate that there is some regularity in this irregular rhythm, where sometimes the heart rate increases and then the heart rate slows down. Then the heart rate increases, then the heart rate slows down. Basically, that is associated with the respiratory inhalation and exhalation. That is a normal respiratory sinus arrhythmia. If you calculate the heart rate in an irregular rhythm, I have talked about how to calculate heart rate, how to look at regularity, P wave, PR interval in detail in my previous video, but we will also discuss it over here. So if you calculate the heart rate, we have 1, 2, 3, 4 and slightly more than 4 boxes. So we have 300, 150, 100, 75, almost 65 beats per minute. And if you take the longer RR interval, in the longer RR interval we have 1, 2, 3, 4 and 5, more than 5. So 300, 150, 100, 75, 60 and slightly less than that. So we have a heart rate of 55 to 65 beats per minute. When the heart rate is irregular, you can give it a certain range, that the heart rate ranges from 55 to 65 beats per minute, where you take the smallest interval and the longest one. And the heart rate is irregular. It is an irregular rhythm. Now, if you look at the P waves are married to the QRS complexes. Every P wave is followed by a QRS complexes, because this is a sinus rhythm. It is run by SA node. If it was not a sinus rhythm where SA node was not in control of the heart, you would have seen that after P waves, the QRS complexes might be absent. If you look at the PR interval, remember a normal PR interval should be within one large box. If the PR interval is extending beyond one large box, that is a prolonged PR interval. That shows heart block. Now, let's look at this PR interval, and it looks like it is within one large box, and that if you calculate the number of small boxes, you will be able to appreciate 1, 2, 3, 4. So 4, every small box is equal to 0.04 seconds. 4 multiplied by 0.04 is 0.16 seconds. If you want to go into detail of these rhythm calculation, I have discussed this rhythm calculation in detail in my previous video. You can check out the link given in the description below. If you look at the QRS complex, now in the QRS complex, this ECG is actually having ST segment elevation MI. This patient is suffering from an MI, but we are not going into the detail of MI because we'll discuss ECGs of myocardial infarction in separate video. In this video, we are only going to target the sinus rhythm, the sinus arrhythmias, the sinus blocks, and sinus arrest. So you have to ignore the ST segments elevation for now. If you look at the QRS complex, this QRS is actually extending down like this if there is no ST segment elevation. So it is a narrow QRS complex with sharp, steep angles, and there are almost more than two small boxes. So it is 0.10 seconds. The interpretation is it is a sinus arrhythmia. SA node is running the rhythm, but it is irregular. Therefore, we have written it as sinus arrhythmia. Now, what you should do is that you should pause this video, solve this ECG yourself, take a piece of paper and solve these ECGs, because till the time you don't solve these ECGs yourself, you won't remember anything. ECG is a very volatile subject. So this is also another ECG with sinus arrhythmia. And look at the RR interval over here, look at the RR interval over here. The P waves are married to the QRS complexes, and QRS complexes are narrow, sharp angles and steep points. Look at the P wave is married to the QRS complexes. So this is an ECG of sinus arrhythmia. Now, this was all about sinus arrhythmia. Let's talk about sinoatrial block. What is sinoatrial block? Now, as I said, that SA node is running the electrical activity of the heart. SA node sends signals to the AV node, and AV node sends signals to the Purkinje fiber and bundle branches and causes contraction of the atria and ventricles. Now, what happens in sinoatrial block is that SA node is actually generating the electrical activity, but that electrical activity cannot exit from the SA node. That exit of electrical activity from the SA node is blocked. Therefore, the electrical activity cannot travel from SA node to AV node and AV node to the Purkinje fiber. And when the electrical activity cannot exit from the SA node, it cannot spread to the atria, and you won't be able to see P wave. You won't be able to see QRS because the ventricles are not contracting. When the ventricles are not contracting, you won't be able to see T waves because T waves show ventricular repolarization. So you will see absent P wave, absent QRS complex, absent T waves, because the electrical current cannot exit the SA node. That's why it's also called as sinus exit block. Now, if you look at this ECG, in this ECG, you can appreciate the P wave, the QRS interval, the T wave, another beat with a normal P wave, QRS interval and T wave. Then all of a sudden, what you see is that there is a flat line. There is a big gap. There is a missed beat where there is no P wave, no QRS, no T wave. That is due to a sinoatrial block. Another very high yield point that you must remember in sinoatrial exit block is that if you calculate the P to P interval, the P to P interval is normal. The beat has been missed over here, but the next beat has came over exactly over the same spot where it should have been. In a normal sinus rhythm, in a normal regular rhythm, this next beat should have been here, and it is actually present over here. one beat has been missed, one beat has been blocked, but the next beat has come at a regular point at the proper P to P interval. If the P wave would have been over here or over here, we would have said that the P to P interval is not equal. So the P to P interval is marching out normally. Just one beat has been blocked, just one beat has failed to exit. So there is a flat line over here, but the next beat is on exact P to P interval. That is a very important point, because this is the point that differentiates sinoatrial exit block from sinus pause and sinus arrest. Now coming to the causes of sinoatrial block. Sinoatrial block can be seen in diseases of SA node, where there is problem with the SA node, MI, coronary artery disease, myocardial infarction, CHF. Certain drug toxicities can cause sinoatrial block, digitalis, quinidine, procainamide, salicylates. It can be physiological due to increased vagal tone sometimes, but the above one causes are more common. Now if you look at this ECG, in this ECG you will be able to appreciate that there is one missed beat over here and then another beat has been missed over here. These beats have been blocked. Now if you calculate the P to P interval, the P to P interval is normal. The P to P interval is normal. Just one beat has been missed. Just one beat has been missed. The P to P interval is normal. That is called as a sinoatrial block, where the P to P interval is marching out normally. Now sometime it can also happen that two beats are blocked. Instead of one beat being blocked, two beats can be blocked. But an important thing is that the P to P interval remains constant. The next beat that appear is coming at a normal P to P interval. It is coming regularly. Just these two beats have been blocked. Three beats can also be blocked, but the P to P interval remains constant. The P to P interval is marching out normally, and this beat comes at a normal P to P interval. That is called as a sinoatrial block. If this P to P interval was not marching out properly, we would have categorized it as sinoatrial pause and sinoatrial arrest. Now let's talk about sinoatrial pause. In sinoatrial pause, what happens is that a beat is missed, but the next beat that comes is not following the normal P to P interval. If you calculate the P to P interval, this is one sinus beat, another sinus beat. This beat has been missed. This beat is missing. But the next beat should have been over here. The next sinus beat, the next P wave should have been here, but it has come earlier. So that is called as a sinus pause, where the sinus node actually paused for some time, it stopped for some time, it waited for some time, but it actually caused the beat. So that is called as sinoatrial pause, because the P to P interval is not following the normal trend. A missed beat is over here, the next beat should have been over here, but this beat is actually coming earlier. That is called as a sinoatrial pause. P to P interval is not equal, that is a sinoatrial pause. Now if you look at this ECG, this is a P wave QRS complex, P wave QRS complex. A beat has been missed over here, another beat has been missed over here, but the next beat, the next P wave should have been started from here. But this P wave, this beat appears earlier. It is not following the normal P to P interval. The P waves should be following this pattern. A beat has been missed. Another beat has been missed. The next beat, the next P wave should have been over here. But that beat appears earlier. That is a sinoatrial pause. Now coming to sinus arrest. Sinus arrest and sinus pause are almost the same. If sinus pause is for greater than 3 to 3 P to P intervals, that is called as a sinus arrest, where the SA node stops firing for a longer period of time. So the sinus pause, which is greater than 3 times the P to P interval, where the 3 beats have been missed, that sinus pause is called as a sinus arrest, because this SA node has now arrested and 3 beats have been missed, or more than 3 beats have been missed. That is called as a sinus arrest. Now if you look at this ECG, in this ECG you can easily appreciate that this is the P wave, this is the QRS complex, this is the P wave, this is the QRS complex, and this is the P to P interval. And from here to here, this is another P to P interval, a beat has been missed. This is the second P to P interval, another beat has been missed. This is the third P to P interval and still the beat is missing. Now this is the sinoatrial arrest. This is sinus arrest where the pause is for more than 3 P to P intervals. That is a sinus arrest. And then as in pause, same goes for arrest. The P to P interval, the next P wave should have been over here, but it is not present over here. It is coming earlier. That's why it is called as a sinus arrest. Now, if this P wave was coming over here on the exact same spot following the normal P to P interval, we would have called it as a sinus block. We would not call it a sinus arrest then. We call it sinus block if the P wave is coming at a normal P to P interval. But in sinus arrest, the P wave does not come on a normal place. The P wave is coming earlier. The P wave came here earlier. The P wave is not following the P to P interval. The P to P interval are not equal, and greater than 3 times P to P interval has been missed. SA node stops firing. That is a sinus arrest. Causes include cardiac conditions and drugs like procainamide, salicylate toxicity, beta blockers, calcium channel blockers. Now let's practice some ECGs. If you look at this ECG, this is the P wave, this is the QRS complex, P wave, QRS complex. And the good thing is that they have already given us the P to P interval, and over here a beat has been missed. There is an absent beat. Now if you calculate the heart rate is 300, 150 and almost 100. So at the shortest interval it is 100, and we'll also calculate the beat over the longest interval. So we have 300, 150, 100, 75, 60 and almost 50. So the heart rate is ranging from 50 to 100. When the heart rate is irregular, you calculate the shortest, you calculate the longest, and you give a certain range of heartbeats. Definitely the rhythm is irregular. The P waves are present and they are married to the QRS complexes. There is no P wave which is not followed by a QRS complexes. So all the P waves are present, they are normal, they are upright, they are round, and they are married to the QRS complexes. The PR interval, if you look at the PR interval is within one large box, so that is a normal PR interval. If you look at the QRS complex is narrow, steep angle, sharp points, less than 3 boxes width. That is a normal QRS complex. And then what do you think? That is it an arrest? Is it a pause, or is it a sinoatrial block? It is basically a sinoatrial block because the P to P interval are marching out normally. The P to P interval are marching out normally. The P wave, the next P wave after the mixed beat is coming at a normal point, normal P to P interval. So it is a sinus rhythm with sinus exit block. So you write it as sinus rhythm. It is a sinus rhythm, but there is a exit block at this point, and it is a sinus exit block because the P to P interval are marching out normally. Now what you should do is that you should pause the video and take a piece of paper, a pen, and solve this ECG. Practice these ECG, make a diagnosis, be it a wrong diagnosis, but try to solve these yourself. Pause the video and solve it. Coming to the answer, if we calculate the heart rate, P to P interval 300, 150, 100 at slightly more, so it is 90 beats. Coming to the longest interval, 300, 150, 100, 75, 60, 50, 45. So it's a quite a big one. I have already calculated the rate. It is from 30 to 90 beats per minute. It is an irregular rhythm. P waves are married to QRS complexes. There is no P wave which is not followed by QRS complex. The PR interval, if you look at the PR interval, it is within one large box, so it is a normal PR interval. If you look at the QRS complex has normal, steep angles, sharp points, and it is narrow, less than 3 small boxes width, and that is a normal QRS complex. The interpretation. Now, if you look at this ECG, the P waves are marching out normally, and all of a sudden one beat is missed, another beat is missed, and then the next beat is coming at the normal point. The next beat is coming at the point that we are expecting a P wave. The P to P interval are marching out normally. So it is also a sinus rhythm with sinus exit block. The two waves have exited, but otherwise it's a sinus rhythm with exit block. If the P to P interval was not marching out normally, if the next P wave would have come over here, we would have called it a sinus pause. Now, what you should do is pause the video, solve it yourself. When you solve the difficult ECGs, the easier ECGs become more easier for you. So try to solve these. Make wrong answers, but try to solve these ECGs yourself. Now let's calculate the heart rate: 1, 2, 3, 4, 300, 150, 100, and almost 75. So 30 to 75. I have already calculated it. 30 is this heart rate, and 75 is the shortest interval present over here. P waves are present. P waves are present, and they are married to the Q. These are the P waves married to the QRS complexes. P waves married to the QRS complexes. If you look at the PR interval, the PR interval is almost within one large box. But if you want to make sure, because it is a slightly longer, we can count the small boxes: 1, 2, 3, 4, 5. So we have 5. 3 to 5 small boxes is a normal PR interval. If you look at the QRS complex is 1, 2. The QRS complex is less than 3 small boxes, so it is normal. It is sharp points, although they have ugly morphologies, but still it's a sinus rhythm. Now let's look at the missed beat. Over here the beats have been missed. Now let's count the P to P interval. The P to P interval over here, the next beat should have been over here, the next P wave should have been here, and after this the next P wave should have been over here. But the P wave appeared earlier. The P wave is present over here. The P wave is not following the P to P interval. The P wave is not marching out properly. So it is a sinus rhythm with sinus pause. If more than 2 beats would have been missed, if this beat was also missing, we would have called it sinus arrest. Now if you look at this ECG, so many beats have been missed. Now the main thing is to calculate the P to P interval. If the P to P interval is following the normal pace, if the P wave is coming at a normal pace, then it is a sinoatrial block. And if the P wave is not coming at a normal pace, then it is a sinoatrial arrest. Now let's calculate the heart rate: 300, 150, 100, slightly more than that, so it is 80 beats per minute. And you can also calculate rate over here, and you give it a range. It is irregular. The P waves are married to QRS complexes. And if you see, there is actually ST segment elevation over here. It is that the patient is having MI, but ignore this for now, because we are going to talk about MI ECGs in detail in a separate video. Right now we are only assessing the rhythm and the blocks. Now if you look at the PR interval, the PR interval is within one large box. Look over here, PR interval is within one large box. And if you look at the QRS complex, actually in this you cannot say the QRS complex is wide, because there is ST segment elevation. Normally the QRS complex would have come down over here like this, so it would have been 2 small boxes wide. So we don't consider the ST segment elevation as a part of QRS complex. Now this is the QRS complex. It is 2 small boxes wide, so it is almost 0.08 seconds. And this is a sinus rhythm. Now let's check that whether it is a sinoatrial block or it is a sinoatrial arrest. It's one of these. Now if you see, P to P interval is starting from here to here, another P to P interval, another P to P interval, one other P to P interval, another beat has been missed, and then the P wave should have been over here, but the P wave is appearing over here. So the P wave is not following the P to P interval. The P wave is not coming at the normal pace that we are expecting it to be. So it is a sinoatrial arrest, because it is not following the P to P interval pathway, and more than 3 beats have been missed. So sinus rhythm with sinus arrest. So it is a sinus rhythm with arrest, because the P wave is not coming on the normal P to P interval. If the P wave would have come over here, then we would have called it as the sinoatrial block. So that is the only difference between sinus arrest and sinus block. Coming to the management of sinus block or pause or arrest, they all have the same management. If the patient is asymptomatic, no treatment is required. But if the patient is symptomatic, where there is severe bradycardia, patient is developing hypotension, patient is unstable, in that case you should first of all rule out the drugs that can cause this, the drugs that I have talked about. Otherwise, if the patient is having bradycardia, pacemaker is the only treatment that you can give in such patients, because SA node is weak, SA node is sick, SA node cannot run the heart now. So you have to put a pacemaker from outside that will keep this heart beating. Before going into the summary, please click on the subscribe button and check out my other videos on ECG, rhythms, and interpretation. We talked about sinoatrial blocks. We talked about how does sinoatrial block appears. It follows the P2P interval. The causes of sinoatrial block. It is following the P2P interval. 2 beats can be missed. 3 beats can be missed, but still it is following the P2P interval. Sinus pause and sinus arrest do not follow the P2P interval. The P2P interval is not followed. In sinus arrest, it is same as sinus pause, but more than 3 beats are missed and it is not following the P2P interval. The causes and the management. If you liked my video, please click on the subscribe button and check out my other videos on ECG interpretation. The link of those videos is given in the description below. Thank you very much.